Kanang nabatasan dyan na nimo nga, kanang nimo ba nga, kanang laylain nun, ako nang maglaylain kong lagi, dili bitaw ko mabugis.
A candid discussion about sex and pregnancy without judgment.
Magpasuso, kasi magpasuso.
These teen parents-to-be are part of a unique program that leverages the power of peers to dispel myths about reproductive health and promote prenatal care and family planning services.
Ang gigamit nga family planning is implant kanang 3 years nga gitaw diri sa bukton. Dara ay pareha mura na siya bilog sa posporo kadako.
Part of a nationwide initiative of USAID, the Philippines Department of Health, local government partners, and the private sector, the Program for Young Parents, or PYP, aims to combat the nationwide epidemic of maternal deaths and reduce unplanned births among girls aged 15 to 19. 9% of Filipino adolescents get pregnant. 11 to 13 Filipino mothers die each day from pregnancy-related complications. The statistics are especially bad in Cebu, where the maternal mortality rate is more than 3 times the national target. I meet 16-year-old Eliza Alexandra Roble, who gave birth to her baby girl Alexa Kay a few days ago.
How are you feeling? Yeah? Were you nervous about having your first baby? Yeah.
She will raise the baby on her own with her mother's help because her boyfriend, a construction worker from another province, left her. It's a sad reality for many teenage mothers who end up suffering from depression or other mental health issues. To make matters worse, 1 in 4 teen moms delivers her second child within 2 years after the first birth, increasing the health risks to mom and baby. It prompted public health officials to find ways to empower this vulnerable community. Pregnant teens are considered at high risk, so they're required to give birth at a full-service medical facility, like the Cebu Provincial Hospital of Danao City. The hospital is home to one of 26 PYP centers in the Visayas region that have served more than 17,000 young clients since 2014. Services are free. It was here that Eliza learned about her options for preventing future unplanned pregnancies and chose to get an intrauterine device, or IUD.
And you're ready to go back to school?
Yes.
Yeah. What grade are you in? Grade 11.
Like most teen mothers, Eliza dropped out of school. Many don't go back due to financial hardship or are unable to find work because they lack education and skills. This takes a broader economic toll on the country.
There was one study by the United Nations Population Fund that states that early childbearing cost the Philippine government 33 billion pesos annually. So that's a big loss in the economy of the government. And therefore, U.S. government as well as the Philippine government work together to make sure that this unplanned pregnancy among our teenage girls would be addressed the soonest.
USAID's head of family planning and maternal and child health says services extend beyond the birth.
Remember, these are girls taking care of babies. And on top of that, we also counsel these teen moms on what do they want or what is their aspiration in life after pregnancy. Because this is not the end of the world. And we have seen so many teen moms who get back to their schooling because we link them with the Department of Health through their alternative learning system. And then we also link them to TESDA so that they can access some vocational training and be gainfully employed in the future. So we know that early childbearing is really a challenge, but given the right support, the right resources, then they can be optimistic, get back on their feet, and be a productive contributor to their family and society. And some of them becomes their peer counselors. So they are the ones who counsel and provide information to other teen moms who are coming to the facility. And they were more reliable than the health workers because they speak from their experience.
Depende ra din. Nakasway ganit po, 9 months, wala po gidugo.
Peer facilitators like fellow teen mom Cheryl Kapol encourage honest, fact-based discussion about sex and contraception, something many Filipino youth do not get at home or in the classroom. Kapol says common misconceptions are that birth control pills, implants, and IUDs will turn people into sex addicts, cause pain, or are harmful to the body. She had those same fears and did not use contraception. She got pregnant at 14 with her then boyfriend, now husband.
Dili na ako mabuntis kung ko gamit ato niya. Kung maminyo na ako, dili na ako mabuntis.
And ituod ka sila?
Oo. O yun na po sila, nakita man po nila na ako nga okay ra ko nga nagamit og implant. Then, nindot po gamit ang implant kay dili ta pareha sa pills bitaw kung makalimot og usa ka tablet mabuntis. Kasagaran sa mga nag-pills pero nagbalhin na sila implant. Dili dugon, madlog sila, dili dugon or sakit ba. Gi-explain na nako nga okay ra na siya basta magamit tag implant, dili jud ta dugon kay wala may itlog nga may mahinog. Walay sakit kay naman siya anesthesia. Amo siya explainan.
Her partner Rilen says boys should be prepared for the consequences if they choose to have unprotected sex.
Akong mga ma-advise sa mga batan-on karon hinaot kung makapabuntis mo kuan inyong uyab inyo lang taon merongon kay luoy kayo ang mga babae kung di merongon kay sila ray magbuhi mailag mo suporta kay ang uban laki ron di na mo suporta.
Teen dads say the PYP has opened their eyes to the hardships their female partners face.
Learn ko sa kanang mga family planning na unsa ipangbutang para makakontrol or dili na mapunan.
Matt Ampo and his girlfriend Faith Patulan, both 15, were embarrassed to tell their parents they were sexually active and wished they knew more about the risks. Now that Faith is pregnant, the couple says they want to share their cautionary story with other young people.
Encourage them na use og kanang protections, kanang antiseptives para kan makalikay sila ng mga young parents sila. Encourage sila nga pag gamit mo ginani kung ganahan mo buhat og ginana.
Maggamit lang jud og kanang mga kanang protection para di masayo buntis nga na. Then i-control lang yun ang ilang mga ang ilang mga biga-biga.
Getting caught up in the moment and their emotions, part of the adolescent mindset that medical practitioners consider when providing services. Teenagers are especially sensitive to public scrutiny and judgment, which is why Chief of Hospital Dr. Prudencio Manubag encourages centers to separate pregnant teens from older patients.
It would be easier for them to talk about what is happening with them because they are the same level, the same age, and most probably the situation is the same. They can relate to each other compared to when they are mixed with the adults. Sometimes they will receive negative feedbacks from the adults. That is why before that I have noticed that these teens and there is poor compliance in terms of prenatal if they are mixed with the adults.
Health officials agree that to tackle Cebu's problem of teen pregnancy and high maternal mortality rate, a new kind of public health strategy is needed.
Make services more accessible to the people there in the periphery rather than in the middle. So by way of that strategy, the government has earmarked a significant amount of the budget. Almost 35% of the budget of the province last year went to health. They practically understood the need of getting the services out into the provincial hospitals instead of into the cities.
Aside from access to health services, the solution starts with having open and honest conversations about sex at the home and community levels.
It might probably start in the home on how these children are being raised, education, and peer pressure once they get into schools. So I guess the internet has also a hand on this. We try as much as possible to help these mothers get into their, well, second pregnancies if you cannot do the first one, because of the high mortality rate that's attached to being pregnant below 18 years old. So yeah. So as far as our numbers are concerned, I think a big chunk of maternal deaths also come from this age set.
An age group that's vulnerable but open to talking about their sexuality. Health officials say this generation is slowly removing the stigma and judgment associated with premarital sex. It's a trend health officials hope will continue thanks to peer-focused programs like the PYP. The PYP is already in medical centers across Luzon and Mindanao as well, like this one in the Taguig Pateros District Hospital in Metro Manila. USAID's Yolanda Oliveros says that while religious and conservative members of society have fought against family planning, the mindset is slowly changing as people view it as an issue of saving lives.
Those teen moms, majority of them suffered from complications out of this pregnancy. And the newborns of these young girls suffered from either low birth weight or they suffered miscarriages. So there are lots of complications that would really put the lives of young women and their babies at risk. Parents could also be educated. And most of the parents who have been with their daughter through this journey really accede for their daughters to access family planning service because they understand the value of delaying the next pregnancy, for their daughters to finish their study. The training module that we are providing to our frontline health workers, especially for the family planning providers, would have that social behavioral change component to make sure that they are not the ones who are giving stigma to the youth. Otherwise, they won't come back to you.
The strategy is working. The number of teen pregnancies is declining, proving that a little peer pressure can go a long way to ensuring the health of the next generation.